Good morning. Thanks for taking a few minutes out of your morning or your afternoon. My name is Michelle. I spoke with my dad earlier this week, maybe the end of last week. He's having surgery again. He's had a dozen or so it's almost very nonchalant topic of sorts that he's updating me on these things, another surgery for the calendar, if you will. This time to replace a faulty battery for his brain stimulation pack residing in his chest wall. It sounds rather invasive, pretty serious to the average Joe, but considered routine. I'm gonna say it's safe to assume most of us know someone or personally have gone through a surgery or a medical procedure, and today I'm touching on medical error. Medical error happens to be the third leading cause of death in the United States, trailing behind cancer and heart disease. With only about 10% of these being reported in a 2017 survey by PubMed. This survey was followed up by an 8-year study by Johns Hopkins University. My visual aid represents a graph indicating the leading causes of death in the US. Roughly 250,000 deaths a year on an oops that we call medical error. The incidence rates for deaths directly attributable to medical care gone awry haven't been recognized in standardized methods for collecting national statistics. This quote comes from Dr. Martin Makary, who is a professor of surgery at the Johns Hopkins University School of Medicine and an authority on public health reform as well. Doctor continues in a quote saying, "The medical coding system was designed to maximize billing for physician services and not to collect national health statistics as it's currently being used." This trend in medical error is growing at a substantial rate, and although there are systems in place to capture these numbers, rarely are facilities utilizing these numbers to educate or implement corrective action. Now let's emphasize that these errors are not captured in death certificates, meaning that there is no medical error checkbox, if you will, on a death certificate. So how does that allow for accountability or corrective action? It seems like somewhat of a controlled narrative that our system allows by camouflaging a death to fit an ICD-9 code. It seems rather insensitive, if you will. Researchers concluded that the module for collecting this death data relies on billing codes, and medical error was simply and unintentionally excluded when put into place. Can you imagine going in for a routine, mundane sort of surgery and an egregious medical error ended your life? And when the ink dries, it falls short of an accurate representation of your death. Food for thought. There is no death to report on at the end of this speech, unless I lost you back in the stats portion of this. My dad will definitely live to see another day and possibly even another surgery.